Hello, everyone. My name is CJ Alexi, and I'm a client relations advisor here with Family Source Consultants. And welcome to today's webinar, Advancements in Reproductive Medicine and Their Impact on Surrogacy. We're honored to have Dr. Saeed Danishman from San Diego Fertility Center joining us to share his invaluable experience in reproductive medicine. I'll go ahead and turn it over to you so you can introduce yourself.
Thank you so much, CJ. It's a pleasure and honor to be here today with you to talk about sort of the before, the now, and the after, sort of the future of reproductive medicine, what we do now, what we used to do in the past, and what we see as sort of a very exciting future, which hopefully will improve not only the rates of success in IVF, but also safeguard the health of surrogates, the health of the children born through the journey of IVF. I've been in practice for about 26 years, really for the past 26 years. I've had the honor and privilege of helping many intended parents here in the US and around the world and achieving their goal of having their families. I'm a father myself of three daughters. They've all flown the nest. In fact, the last, my youngest, we dropped off in college just a couple of months ago, and whilst I
Congrats.
miss them dearly, I'm excited for their next phase in their sort of journey of life. So this is what I want from my intended parents, and I'm excited to be here.
Awesome. Well, we can't thank you enough for joining us. During this webinar, Dr. Danishman will take us through key topics such as the evolution of fertility treatments over the past 15 years, recent breakthroughs in testing and techniques that have transformed reproductive success rates, ethical considerations surrounding genetic screening and embryo selection, and the future and what that holds for reproductive medicine and surrogacy. So without further ado, I'll get started and ask some questions of you.
Sounds good.
So reproductive medicine has seen some incredible advancements in recent years. Could you start by giving us an overview of what reproductive medicine was like 15 years ago?
Absolutely. So I think when you look at 15 years ago, there were a couple of things that are a few things that are very different, were very different then than compared to now. Number one, success rates. So we used to transfer single embryos, sometimes two embryos into the uterus to maximize success. Why? Because each individual embryo had somewhere around maybe a 30 to 40% rate of making it to a pregnancy and a delivery. These days, a single good quality embryo that's chromosomally tested and has been deemed normal has up to a 81% chance of pregnancy and delivery. So we've come a long way through modifications and advancements in protocols, in lab techniques to improve the success rates with IVF. So success is one factor. The other factor is the revolution that's happened in genetic screening of embryos. So many years ago, let's say 15 years ago, we used to do an analysis of the embryo on the day 3 stage. So when we retrieve eggs from the ovaries, we fertilize the eggs, and then we let them develop over the course of 5 to 7 days until they get to a stage called the blastocyst. And the blastocyst has 128 cells. And we do the chromosome analysis these days on the blastocyst, where we take a few cells from the placental cells and do the analysis. Well, in the old days, we used to do the analysis at the day 8 stage, or the 8 cell stage. I shouldn't say day 8, I should say day 3 and the 8 cell stage, meaning that the embryo had 8 cells, somewhere between 4 to 8 cells. And when we took one of those cells or two of those cells, we were actually taking a significant portion of that embryo, causing some potential harm, increasing the risk of that embryo stopping development. And then the results were not as accurate because when the embryo is still at the 8 cell stage or day 3 stage, there's still a great deal of mosaicism. Some of the cells could be normal, some of the cells could be abnormal. And then as the embryo grows, the embryo is going to incorporate the normal cells into the fetal cells and sometimes push out the abnormal cells, either push them out and sort of extrude them, or place them into the placental cells. So therefore, doing a chromosome test on an embryo that's more advanced, which is the blastocyst, is much more accurate and a much more sensitive and accurate assessment of of the cells that are going to be giving rise to the fetus. Of course, we test the placental cells, 4 or 5 of them, but there've been studies looking at the fetal cells and the placental cells, and there seems to be very good correlation at the blastocyst stage. So less harm to the embryo. In fact, there's no evidence of any harm now to the embryo when we do the biopsy on day 5 or 6 or 7 at the blastocyst stage, whereas there was testing some potential harm to the embryo on day 3 when it was somewhere between a 4 to 8 cell stage. So that's a second issue, genetic testing. And within the genetic testing spectrum, we're now able to test for much more. Not only are we able to test for chromosomal abnormalities like Down syndromes, Down syndrome, monosomies, trisomies, we can also test the embryo for specific genetic mutations, cystic fibrosis, thalassemia, polycystic kidney disease. If a patient comes to us and they have a family history of breast cancer, and there are some mutations that are associated with breast cancer, well, we can test the embryo for those breast cancer genetic mutations. So now that advancement is at a point where if a particular genetic change or mutation has occurred and has been identified, we can test the embryo for that genetic mutation. So that's a second sort of advancement that has happened. The third is really our overall care and assessment and treatment of patients. We're able to better and more accurately diagnose different factors such as egg reserve issues, sperm factors, uterine factors, and now we're able to tailor the treatment much more effectively to the problem. So for example, if there's a decrease in ovarian reserve, we have more tools at our disposal now to treat decreased ovarian reserve. If there's sperm factors, we now have the ability to select out the best quality sperm based on DNA integrity, based on morphology, to fertilize the eggs with a normal DNA sperm. And of course, based on many studies, many of those studies we published ourselves looking at the receptivity of the uterus, we now know exactly when the uterus is receptive and when is that window of time when the embryos need to be transferred to maximize the chance of pregnancy. So these are 3 factors that have been important in terms of the evolution of IVF from about 15 years ago to now.
Amazing. Yeah, a lot of techniques and standards that have changed over the years to just better reflect and have better outcomes for patients. So that's great. And what impact do these changes have on the success rates? Have you seen such a drastic increase?
Absolutely. And to your point, CJ, that's a really good point. We've had a significant increase in success rates. As we talked about, sometimes we would transfer 2 embryos 15 years ago in order to maximize success. You're transferring 2 embryos.
Hoping that one would go forward.
Exactly right. So if one would stop developing, we'd have the other one that would move forward. But now the success rates are so high that we only recommend transfer of a single embryo. Why? Because as you know, twins have a higher risk of premature birth and high blood pressure, gestational diabetes, many different complications. But now a single embryo that's good quality, that's chromosomally normal, can have anywhere between a 70 to 81% chance of making it to delivery. So there's really no need to transfer more than 1 embryo because the success rates have improved so much. And again, this is a shout out to not only just physicians, doctors who are taking care of patients, but the entirety sort of the team, including the lab team and all the advances in the lab that have occurred over the last 15 years. You know, the care of patients every day when they come into the office, surrogates, egg donors, intended parents. So everything is really advanced over the last 15 years, which has really been exciting because it's a fast-moving field. And it's really important as physicians, as healthcare providers, as medical assistants, as nurses, for us to keep up with all aspects of these changes because they're changing fast. And these particular changes are all geared towards maximizing the health and the success rate of IVF.
Amazing. Yeah. And as IVF has advanced as well. The societal perception of surrogacy seems to be evolving alongside the medical advancements. With the advancements that you've seen in IVF, have you seen a change in the demographics of people seeking surrogacy?
Absolutely. I mean, I think that, when I first started taking care of intended parents who wanted to work with a surrogate to have their children, this was just over 20 years ago. And I think it was a very small group of intended parents. And there wasn't a community that they could sort of reach out to and say, my friends went to through surrogacy to have their children with the help of an egg donor and surrogate. So I remember the intended fathers who first came to me must have been about 20, maybe 4 years ago, 25 years ago. It's amazing because um, the intended fathers came to me. They brought their egg donor and they brought their surrogate and said, Dr. D, we want to have a family. She's our egg donor. She's our friend, but she wants to be our egg donor. And she is our friend and she wants to be our surrogate. We talked about all the screening that we needed to do with their egg donor and with their surrogate. We talked about the journey. And that was about 25 years ago. And that was the first couple, first gay couple who I helped go through the journey, the surrogacy journey to have their family. It's sort of brand new, and they didn't have a community to reach out to for support. Now what's happened is there is a community. And one of the things that we've done and I've tried to do over the last 25, 26 years is no matter where I go, whether it's New York, whether it's Berlin, whether it's Paris, and we have so many of our intended parents together that we've helped. But wherever I go, I've gone, I've tried to connect people together. So to create a community who can support one another as they're going through this journey. The journey can be at times complicated, emotionally, physically, financially, not easy to move forward with and to navigate. So having a community to reach out to has been really an important step. And this community has been built over the course of sort of a last quarter century.
Yeah, and having that support system in place is so crucial because there are so many third parties involved in a surrogacy journey. Having that support is really there to help you succeed and, feel supported and informed and excited to become parents through the process. So,
Absolutely. Totally. I
um,
completely agree.
do you have any like rough statistics on what percentage of people or families go through fertility treatments or egg freezing?
Well, if you look at fertility treatment in general, about from, let's say, among a group of heterosexual couples, somewhere around 15% to 17% of heterosexual couples have fertility problems, meaning a sort of a failure to conceive or more difficulty with conception, and they come in initially and consult with a fertility doctor. So that's sort of the population. When you look at the population of just intended parents who are going through surrogacy, the data is overall in the United States, you're looking at several thousand intended parents, a significant number of intended fathers who are going through the surrogacy journey to have their children and to have their families. And then you also have other intended parents who are going through because of medical conditions, because there are problems with carrying the pregnancy, or there are medical complications or conditions that are going to complicate their health if they were able to carry the pregnancy. So those numbers have increased. I think the last numbers that are published by the Society of American Reproductive Technologies was that there were several thousand, but I think that maybe that's an underestimation. Not all clinics in the United States are members of the American Society of Reproductive Medicine, of SART, the Society of American Reproductive Technologies, of the CDC, Center for Disease Control. Not all clinics declare their numbers or success rates to them. So I think the numbers are underestimated, but certainly somewhere in the sort of 4,000 to 4,500 were the number of intended parents going through. But those I think are underestimations, and those are sort of numbers that were published several years ago.
Gotcha.
But what I've seen in my own practice is sort of a significant increase. From those days in 1999, 2000, where we welcomed our intended fathers to our office, to to help them have their family, the numbers have continued to increase because there's more access. There's a bigger community who is supporting one another and talking about the journey. And I think also many companies are now starting to cover fertility treatment for heterosexual couples, for gay couples. There is a legislation that passed in California that is a mandate for California now. California has to, insurance companies have to cover fertility treatment or family building treatment for everyone, irrespective of sex, orientation, it doesn't matter. Everyone has a right to have a family, and that legislation is going to address it. And so there's going to be now better access, more financial help for those intended parents wanting to have children.
Yeah, I just saw that. That just came through like last week, and could
Right.
not be more excited for that type of legislation. Hopefully, more states adopt the same plan,
Absolutely.
because obviously, if treatments are more affordable and can be covered, more people will seek out these services and
So true.
um, choose these options for building their families. So amazing.
It's a
Um,
great point because many people, I think, are, and you made a really good point, because many people are not aware of the fact that they could get help, get potential financial help from their insurance in order to be able to build their family. So once they're more aware, that's just going to increase access for everyone.
Yeah. Well, that's amazing. And we always stress to the intended parents that come to us for that advice, we always connect them with resources and, potential grants or groups that provide those funds so that they can become more affordable. So that's always something that we hope to encourage our intended parents to look for.
That's
Um,
terrific.
with the ability to screen for genetic conditions and select certain traits, where do you see there any line ethically that you would draw in those scenarios, in those types of scenarios?
Absolutely. I mean, I think there needs to be ethical guardrails, ethical guidelines, because as we're sort of moving forward with further genetic testing, we're not still at a point where you can sort of select out genetic traits, like, eye color, height, those kinds of things, because there are multiple genes that are involved, and I'm not sure if that's something that where we want to go to anyway.
Right.
But you're right. There needs to be ethical guidelines, ethical guardrails. The society that what we belong to, the American Society of Reproductive Medicine, has recommendations and guidelines for sort of addressing these ethical concerns. But some of those guidelines are just guidelines and recommendations. I think there needs to be better enforcement. I have a podcast called Fertility with Dr. D. And in one of the episodes, we talk about some of these ethical considerations and ethical guidelines. So the fact of the matter is that the genetics is really rapidly advancing. And there's a new technique called PGTP, pre-implantation genetic testing for polygenic conditions, meaning polygenic, meaning conditions that have roots in multiple genetic changes.
Hmm.
That's going to be able to diagnose potentially a higher risk in embryos that may have a high risk of diabetes or high blood
Oh,
pressure,
wow.
or heart disease, or neurological conditions. But then you're going to have a group of embryos, and each embryo may have a propensity or high risk for a particular condition. So do you not transfer any embryos? Can you transfer affected embryos with, obviously, with the consent of intended parents? So, and then what other traits and conditions are we selecting out for in terms of traits, physical traits like you discussed? I do think there needs to be good, strong ethical guidelines in regards to that. I think the overwhelming majority of fertility specialists are cognizant of those ethical concerns. So we just want to make sure that there is a body that talks about guidelines, recommendations, and the ethics of this technology, because it's rapidly evolving.
Yeah.
Much like in artificial intelligence, where there needs to be some ethical guidelines because that technology is just exploding. The same
Yeah.
thing is happening in the field of genetics and IVF as well.
Definitely. Awesome. And What do you think may happen or will happen within the next 15 years of these advancements in your field?
Terrific question. I think there are three factors that are going to be really, really important. And I think these three arenas are going to be um, experiencing great deal of growth, advancement. The first, we talked about it a little bit, artificial intelligence. How can we harness the power of artificial intelligence to help us treat patients? Well, artificial intelligence requires data, and then that data is analyzed, and then a particular response is generated. They talk about sort of GTP being generative, transformative, um, and um, and it's pre-trained. So GPT standing for generative pre-trained transformer. So it takes data, it analyzes it, it looks at the context of words and how they sort of belong with one another. And there are all these like 16,000 algorithms that it undergoes in order to generate an answer. Well, in IVF, we have a set of data, a patient's medical history, background, medications they're taking, fertility treatments they may have undergone. That data is analyzed, and then a particular treatment is offered to those particular patients. Well, if we can use artificial intelligence to look at hundreds or thousands of data points and then be able to assess and see what is the best treatment modality for these particular patients given this medical history and these characteristics, then we'd be able to harness artificial intelligence for use in IVF. Another area artificial intelligence that can help us is be able to detect nuances in embryos. Right now, we transfer embryos based on their cell structure, cell quality. We have objective parameters. We look at the diameter of the fetal cells. We look at the cross-sectional analysis of the placental cells. But there are nuances that are not visible to us to the naked eye. Artificial intelligence can analyze data from thousands and thousands of embryos and determine which may have the highest propensity and potential for reaching a pregnancy. Artificial intelligence looking at embryos, analyzing them, analyzing their structure. The same thing, artificial intelligence can do analysis on multiple genetic parameters. So I do think that's an arena that will explode and
Yeah.
will be helpful, but again, requires guardrails, requires ethical guidelines. So that's one factor. The other factor is what we talked about is I think genetic screening will just get more and more refined. We're going to be able to diagnose, mutations or DNA changes that may increase the risk of certain conditions like Alzheimer's or Parkinson's, neurological disorders, diabetes, ischemic heart disease, those kinds of things. And then we have to then decide, okay, what we do with that information and how we counsel and support our patients to be able to have the families that they want. So that's a second factor. And a third is automation. So there's always ways in which we can increase the accuracy of everything that we do, the sensitivity and specificity of everything that we do. Well, automation is already happening. We introduced the first robot in the United States for cryopreservation, cryostorage of embryos, eggs, and sperm. It's digitized. It has radio frequencies, so devices that tag each particular vial with the embryos, each cryo vial of embryos or sperm or eggs. So the retrieval of those through a robot is going to be much more, accurate. It's automated. The robot is self-sufficient. So if let's say there's a natural disaster, electricity goes out, then it maintains temperature for many, many days. So automation in the lab, selecting out the best quality sperm based on DNA integrity, cryopreserving embryos and eggs and sperm and making sure that the particular vials are in a specific area and then all the conditions, lab conditions, remain very steady. Nitrogen, oxygen, temperature, all of that. If there's any perturbation, the machine can sense it and create a warning. So
Mhm.
automation, I think, is also the next sort of frontier in IVF as well, to just improve success rates, improve the accuracy of analysis of sperm, of eggs, and it's exciting. There's the American Society of Reproductive Medicine conference coming up in the next couple of weeks. We are presenting many papers at this particular conference, and we're excited to also hear our colleagues, present papers, and we'll see what happens this year in terms of some of the other advancements that have happened so far.
Yeah, really exciting stuff to come up
It
in
is.
the coming years, and hopefully just more and more babies will be born using this
Yes,
incredible technology that just seems to be getting better and better. So, um,
absolutely.
what advice do you have for people considering expanding their families via surrogacy and egg donation?
I think, selecting the best team around you is going to be the one advice I have. A great clinic IVF doctor who's really skilled, experienced, who has experience in academic research, who's really up to date on the latest techniques and technology. So from that perspective, a fertility clinic that has a great deal of experience in the field of surrogacy, in the field of IVF. So that's doing your due diligence in terms of finding your doctor. It could be from word of mouth, goodwill. Do your research online. Um, Picking an agency that has a great reputation, who's been around for a long time, helping intended parents for many, many years. I mean, Family Source has been doing so for, I think, 20 plus years. So, and they have a great team. So again, having a great team around you, and the same thing happens with your reproductive lawyer as well. So remember that this journey is sort of requires a team. None of
Mhm.
us can do this on our own. It requires a whole team. Here at San Diego Fertility Center, we have a whole team of physicians and nurses and medical assistants and lab technicians and lab experts. And so your agency has a whole team who supports intended parents, and then you have the reproductive lawyer. So these sort of three elements of your journey are going to be important. And I would just recommend doing your due diligence and research, and picking a strong team around you.
Definitely. And that's exactly what we stress. Working with a fantastic facility like San Diego is paramount to
Thank
have
you.
a smooth and efficient journey, as there are a lot of moving parts and a lot of obstacles that could come up. It's just
Yeah,
working with a team that you trust and feel supported by will definitely be beneficial for you as you move through each stage. So
so
I
true.
appreciate that.
My
Well,
pleasure.
those are all the questions that I have for you. Thank you so much for joining me today and, you know,
Absolutely.
going through all of that information. It's been really exciting to hear, and I really appreciate it.
My pleasure, CJ. It's been wonderful spending this time with you, and I'm excited for our intended parents who are going to benefit from all these advances that are happening in the field, and so that they can reach their families. I mean, I'm a father of three daughters, and I want the same joy for my intended parents that I've had all these years, and it's been an honor to have been a father and to continue to be a father. I derive the greatest joy from spending time with my daughters now. So that's uh, I want the same for our intended parents. So thank you for this time that you afforded me.
Yeah, and thank you all for joining to watch the webinar today. And we hope to hear from you. If you are considering family building options, reach out to San Diego Fertility Center to set an appointment with Dr. Danishmand, or set a consultation with me where we walk through each stage of the surrogacy process, from start to finish. But we appreciate your time and have a great day.
Terrific. Thank you.